Hi there, I'm Dr. Sood at Brampton Missisauga Vision Centre, and I wanted to take a few minutes today to talk to you about a relatively new but very important aspect of our practice, which is myopia management in children. Myopia, otherwise known as nearsightedness or the inability to see distance, is an all too common problem worldwide. 50% of North Americans have myopia, and in our children, the prevalence of myopia has doubled in the last 20 years. The concern with myopia is that children that display it at a young age are much more prone to sight-threatening eye disease later in life. Problems such as glaucoma, retinal detachments, retinal tears, even some forms of macular degeneration are linked to early myopia. So for us to be able to do something about this and slow it down is really, really important. So I'm going to give you guys a little image here or use this little model to explain a couple things. So this is the eyeball, this is the front of the eye, and this is inside the eye. So what we do know about myopia is in children that have it, their eyeballs are abnormally long. And what's happening as their prescription is increasing, their eyeball is actually getting longer. So longer the eye, or longer what we call the axial length, the thinner the back of the eye, which is quite concerning. And then of course, the glasses prescription increases. So if we can get a hold on this, that's kind of the battle that we're trying to manage. What we know is that if we are able to provide a clear image to the back of the eye, surrounded by a little bit of defocused imagery, it will help send a neurological signal to the brain and to the body to help slow down this abnormal growth and then control the pace at which the prescription is increasing. Now, at Mississauga and Brampton Vision Centre, we use several different management techniques to control myopia, and we also are able to measure this axial length using special technology. Some of the management plans will either include the child wearing soft contact lenses all day, who have the technology to help control myopia. Other forms of management can include just glasses with, again, types of lenses in those glasses that help produce that signal to help stabilize the eye. There are also eye drops that can be prescribed by our doctors for the child each day, and at low doses, these drops, which are a form of atropine drops, that will help stabilize the eye from changing too quickly. Orthokeratology is another type of myopia management and involves the child wearing hard lenses just before going to bed, almost like a retainer. When they wake up in the morning, these lenses are taken off, and there's two benefits. One is that the child can see usually 20/20 for the whole day without any other aid. And the second is that it does provide myopia control or management and help slow the progression of it. In addition to these myopia management treatments, we also spend a fair bit of time with the children telling them to watch the working distances, not holding things too closely, and spending time outdoors, as those are two things that have shown to help in slowing myopia progression. I would encourage parents to look into myopia management for their children, especially if there are signs of myopia in their kids or if there's a strong family history. If you have any questions at all, don't feel free to call us at the clinic or book an appointment for your children. Thank you.